Hello, everyone, and Happy New Year. Welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. So January is Alzheimer's Awareness Month, and I just would like to take a few minutes to let everybody know about all the amazing free resources that the McGill University Dementia Education Program offers. First of all, we have this great dementia companion guide that can either be downloaded for free or you can purchase a copy on Amazon for $20 and all proceeds support our program. It has been translated into multiple languages, including English, French, Spanish, Portuguese, Italian, Greek, Mandarin, and many more languages to come. And this book is thanks to the Grace Dart Foundation. We also have a virtual support for caregivers. We work in collaboration with the Alzheimer Society of Montreal to offer virtual support for spousal and children caregivers. And we also have a new program called Caring Conversations in collaboration with McGill School of Social Work, which is more of an interactive support led by Lucy Baralek and Joanne Besner. There's different topics, and then the audience registers and you can participate and ask questions. And also, as we are in the winter time, the McGill School of Physical and Occupational Therapy, the students a few years ago developed an amazing activity booklet, which has over 40 different stimulating activities that you could do with your loved ones. So I encourage you all to download it for free as well. It's available in English and French. So that's my little promo for our program. And also, just so that you know, we've developed over 80 episodes of McGill Cares that can be downloaded at any time, and also that are available on Spotify. So in recognition of Alzheimer's Awareness Month, I'm so thrilled to be having my guest today, Dr. Saskia Sivananthan. She is the Chief Science and Knowledge Translation Officer at the Alzheimer Society of Canada, where she oversees the Alzheimer Society Research Program. She is a neuroscientist and health data scientist focusing on dementia care. In 2020, the Federal Minister of Health appointed her to the Ministerial Advisory Board on Dementia. She also served as a senior strategy and policy advisor on the global dementia strategy for the World Health Organization and co-drafted their global action plan on the public health response to dementia. Ms. Sivananthan will discuss highlights from Canada's National Dementia Strategy and the landmark study report that was just launched, Navigating the Path Forward for Dementia in Canada. I'm so happy, Saskia, to have you with us today. Welcome to McGill Cares.
Thank you for having me. It's a pleasure to be here, Claire.
So, as one of Canada's leading experts on dementia, I think one of the first questions I'd like to have is, how did you get involved in the field of dementia?
Oh, that's been quite the journey. I've always been interested in understanding more about the brain, and through my undergraduate studies, this was sort of a trajectory for me. But I actually started my graduate work at McGill, and I was really in the basic sciences area, really neuroscience, trying to understand, what's the underlying cause of dementia. That's where I started my career. But I realized, I was in a lab trying to understand dementia and Alzheimer's specifically, but I wasn't meeting with patients. I wasn't meeting with families to understand what that felt like for them navigating the health system. So I started volunteering at the memory clinic that's in Montreal. And it was really a life-changing experience for me. I started working closely with Howard Chertko and Howard Bergman, both of whom sort of founded and run that memory clinic at the time, and 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 really better understood the more immediate struggles that families and people living with dementia were experiencing. And on a personal note as well, I was living in an apartment in McGill, and my neighbor had mild cognitive impairment, likely had dementia, but hadn't been diagnosed and was really struggling. And I really got to become, he and I became really good friends. I started supporting him more. And one of the big pieces that came up for me was how fractured the pathway of care is. There is no pathway of care for
No.
dementia. So, he would basically go to an emergency room almost every other weekend because there was no other option for him in terms of getting the care he needed. He would become so overwhelmed with all of the needs that were unmet. And that's when I decided to really change my life course, basically. And I started shifting my work more to focus on public policy, the here and now, and trying to support people living with dementia as best as I could.
So, what is the symbolism of Alzheimer's Awareness Month, and how does the Alzheimer Society of Canada recognize that?
Well, Alzheimer's Awareness Month, I personally think should be actually much broader.
Mm-hmm.
It's Dementia Awareness Month. People often think of Alzheimer's and the Alzheimer Society as only supporting one form of dementia, but we know that most often it's now mixed
Mm-hmm.
dementias, and vascular dementia is another very common type of dementia. But it's for the Alzheimer's Society, it's very much about reducing stigma around the disease. People are still afraid to talk about it, to get the support they need, because it's seen as a mental health condition and one in which people often feel, though I think incorrectly, that there's not a lot of hope.
Mm-hmm.
And so they don't want to come forward to get a diagnosis. They don't necessarily want to know more about the disease. And different communities deal with it differently. So every year, the Alzheimer's Society really focuses on raising awareness around the disease itself, but that there is support and that there is education and that there are things that you can do if you are worried and if you do have a diagnosis, to support yourself better. And of course, you know a lot about this as well, Claire, firsthand. And that's really where we've been trying to focus on that, as well as our First Link program, which is a cornerstone program for the Alzheimer's Society. It's about connecting people living with dementia to support services and education across the country.
You said earlier that the system is fractured, and I completely agree. I mean, my mother was diagnosed in 2006, and the prescription of care that we got was good luck. And,
Yeah.
Imagine telling a person who's diagnosed with diabetes or heart disease or cancer, good luck. You and I did an interview for the World Alzheimer's Report this year that showed this is not only happening on a global on a national level, but this is happening on a global level. Like, the system is fractured. Why do you think that is? Like, why is there that such a lack of support for for this illness? Like, what is it? What is it about it?
I do think that we're at a bit of a pivot point for the disease, and we'll probably talk a little bit about
Mm-hmm.
the more recent clinical
Mm-hmm.
trials and treatments that are coming out. But I almost see where we are with dementia as where cancer was 20 to 30 years ago, really still at that early inception point of talking about the disease, understanding the disease, the pathway, and what it could look like. But the other piece is that it does primarily affect older adults. And I think our societies generally tend to disregard older adults. We don't value their experiences, we don't value their health and what they can continue to contribute to society. And that has been another reason why we've just not grappled well with wanting to understand and do better for people who are living with dementia. I mean, when I was at the World Health Organization, one of the pieces of work we had to do when we were developing the Global Dementia Action Plan was to look globally at what do other countries do? What have they done? Now, first of all, Canada was the last G7 country to even develop and deploy a
Hmm.
dementia strategy. But if you did look at other countries that had been sort of dealing with this, countries like France, Germany, the UK, Japan, who have a aging population, they had started dealing with dementia earlier, but even they had not really progressed very far in terms of the kinds of pathways that they could create and support. Some are better than others, but they're still not at a treatment pathway where, as soon as you get a diagnosis, it's not go home, good luck, figure it out,
Mhm.
but here are your options. Here's how we're going to continue to fight for and support you. And here's what your care partners and families might need. That is still lacking. It's getting there, but we understand so little about the disease as well, that it's really held back how people and how the health systems could better support things.
So the Alzheimer Society of Canada published a very important report called the Landmark Study that was launched just in the fall of 2022. And I saw you doing a lot of rounds on the media talking about it. Can you give us some highlights from the report?
Sure. So the landmark study is actually a series of reports. We launched the first one in September, and the intention was really to update the numbers on the number of people living with the disease, what the impact of the disease is, because the last numbers, at least that the Alzheimer Society had updated, was over 10 years ago. And this is another piece we'll talk about, I'm sure,
Mhm.
Claire. We
Mhm.
we don't do a good job of tracking. And if we don't have the data, it's very difficult to really create action and make change.
And the
Uh,
tracking is because people don't recognize the signs and symptoms, right? And
they don't
so
come
there are
in.
many people that are not
Yep.
diagnosed, correct?
That's right. That's part of it for sure, but
Mhm.
also just tracking in terms of our health system and the data side of how we might diagnose someone living with dementia and how we look at them over time and how they're using the health system. We don't really have a good understanding of diagnosis rates, even with the current data. And that's because I think our health system is, we've got 10 different health systems, really. We've not got one health system.
Mhm.
But so coming back to the landmark study, the first report was focused on updating those numbers. We're working on the second report right now, which is doing a deeper dive to understand how does this disease impact you? What does this look like for Canada 10 years, 20 years, 30 years from now? And what we're going to see is that even what we think of as the face of dementia is going to change quite significantly. We're going to see other immigrant populations that have really shifted the landscape of dementia. We'll see what, how gender impacts all of this. So that's part of the second report. And then the third report will be focused on basically delivering the bill. How much is this all going to cost if we're going to do this well in terms of supporting people? The
So the
highlights,
landmark study,
yeah.
just to let everybody know that the landmark study is available on our website under trusted resources, so people can have access to that report.
Oh, thank you, Claire. Yes, it's
Yeah.
also available on our website in a web readable format.
Mhm.
If
Mhm.
people can't download the PDF, you can scroll through and there it's easier to read on the web page. There are two options there.
Mhm.
But the highlights from that first report uh, is the number of people living with the disease is staggering. But more importantly, is the number of caregivers who'll be dealing with this disease. It's not a small number, and what we know is that the number of caregivers, if you look at caregivers, most of the focus of care comes from people who are providing care for free. It's not paid care support. And that, when you translate that into cost, is something like 235 or 250,000 full-time jobs right now that caregivers are providing in terms of unpaid care. And that number is going to increase significantly over time. But one of the messages of the study was to also focus on, is there hope? And there's been some really interesting research and groundbreaking research around risk reduction, and that there are a lot of factors and things that you can do to reduce your risk of dementia if you are at risk. But those factors hold true even if you've been diagnosed with dementia. They are still important. So things like addressing hearing loss, really trying to get a good night's sleep and what that could mean. Physical exercise continues to be some of the most important ways in which you can modify your risk, but also continue to modify it even after you've been diagnosed. And what the report showed is that if we could starve off dementia by even 1 year, um, of onset, that it would have huge impacts on our health system, the number of people living with the disease, and the cost. And it's an area that we really don't focus very much on.
So what are some of the biggest challenges that care partners face? Like, did the report would talk about like what the challenges that the caregivers are facing? Is there some things that have stood out more than others?
So the first report highlighted it a little bit, but the second report is really where we want to delve in a bit more, because I think you're right. The caregivers often do get overlooked in some ways.
Mhm.
Um, a lot of the challenges that caregivers identified for us that they were dealing with, and we hear it as well because we have a 1-800 number, and most of the callers are caregivers and family members who call into our national dementia line asking for support and information. The biggest piece is caregiver stress and burnout. They're not getting the support that they need early enough. And so they kind of try to do their best to manage, and then it hits a crisis point, a stress point, and then you're in and out of the hospital. You have to suddenly figure out long-term care. That's a very difficult
Mhm.
transition to make, and the caregiver often overlooks their own health in order to be able to take care of the person, their loved one. And so that becomes a further stressor because caregivers often have their own chronic conditions that they might be dealing with. And so that's one of the areas that really stood out in the report, and that we will delve into a little bit more in the second report.
And I would also have to add, I think it's a total lack of education about the illness, right? I mean, this is an
Of
illness that is
course, yeah.
constantly evolving, and care partners are just not prepared to be able to manage the ever evolving symptoms, or how to manage the challenging behaviors, or or even just being trained to, as the disease progresses and there's bigger physical requirements, how to assist with the activities of daily living. And so it's a very, very complex disease, and I feel like, I mean, because I lived it, but working with so many families, a lot of people feel so isolated, so alone, or even the topic of feeling angry, or feeling that this that their loved one has become, this disease the disease has become a burden. People are,
Yeah.
they don't feel that they have a place where they can go and express their feelings. So talk to me about the 1-800 number. So what is that 1-800 number? Can you tell us what it is?
Yes, for sure. I just want to come back to that
Mhm.
last piece that you mentioned, Claire, because
Okay.
it's such an important point. The anger, as well as loss and
Mhm.
grieving in some
Mhm.
ways as well, we don't often acknowledge it, but the disease changes the person whom you thought you knew, and sometimes
Mhm.
there's a grieving process that people go through, and it's hard because you feel bad about wanting to talk about that, or even acknowledging that. And you're right, there are a range of other emotions that are difficult to talk about with this disease. And we really are trying to focus on providing supports for caregivers and family members in that area. So the 1-800 National Dementia Info Line was launched actually as a pilot last year. And we launched it because of exactly what you highlighted. We were getting calls at the Alzheimer Society of Canada from family caregivers asking for support, who were overwhelmed during the pandemic in particular because they were isolated, they couldn't see their family doctors, they were not able to come in for any of the cares, the support groups and day centers, and they had no resourcing, none. Um, and so we launched the 1-800 number to help answer questions as best as we could for people who are coming and wanted education. And the number one question we get often is things like, well, what does it mean? My mom has, been diagnosed with dementia, and my family doctor didn't give me any information. I don't know what to do next. What are the next steps? And then often it's very practical questions like, how do I deal with finances?
Mhm.
What does power of attorney mean? These very, what should be clear, simple answers are not simple with this disease. So the 1-800 number was launched, and it's available on our website. There's also an email address, info@alzheimer.ca, where you can email in to ask your questions. And we have a live client support staff who will answer your questions via email or through the phone number.
And the phone number, is it a 1-800 number that people could access 7 days a week, or is it something that's more limited? Like, what are the hours for it?
No, it's a great question. So it's
Yeah.
available right now, Monday to Friday, 9 to 5 East Coast time. Because as I said, we launched it as a pilot. We wanted to first see if, see if we can do a good job of answering the immediate questions
Hmm.
and needs. And then we will hopefully build it out to be able to provide broader support. So the number, I keep calling it a 1-800 number, but it's actually 1-855-705 4636. And the number is on our website. But the most important part about calling into this number is it also gives you direct support to local societies.
Okay.
So our client service staff will connect you in with a local Alzheimer society, like the Alzheimer Society of Montreal, whom you're working with. And you'll have staff who can better understand immediate community needs.
So we will make sure to put that link directly also on our website so that the viewers can access the number and get that support that they need when they need it. That's a very important resource. So let's turn now and let's talk about the national dementia strategy. Like, how does Canada compare to the rest of the world? And how is the Alzheimer Society of Canada working with the federal government right now?
Um, So when the strategy was being developed, I remember I was actually at the WHO at the time, and we were looking at other strategies and action plans that had been created. And one of the things about the Global Dementia Action Plan was that it highlighted sort of 7 key pillars and areas that countries could and should focus on. And Canada's National Dementia Strategy is excellent, actually, in that it really touches and focuses on those core principles, the main areas, and it's a difficult thing to do. I think I want to acknowledge that the federal government doesn't have jurisdiction really over how healthcare is delivered. So the strategy needed to be able to address what the federal government can do while giving provincial governments the autonomy that they need to change to adapt the health system delivery for dementia care. But what the strategy does do is focus on risk reduction, which is a core area that the public health agency in particular can deliver. It also focuses on research, funding better research, which we can talk about a bit more because Canada is really underfunding research in dementia. It focuses on human rights, which is something that the Canadian strategy does very well in comparison to other national strategies that other countries have developed. It acknowledges that just because you've got a diagnosis doesn't mean that suddenly your rights are gone. You're done. You can't function on your own anymore. But it also acknowledges that the disease progresses. And as that progression happens, that's when you will lean more heavily on caregivers and families. Um, it also talks quite a bit about post-diagnosis. And this is, I think, the biggest
Mhm.
fracture point in our health system. Operationalizing the strategy is probably a different question. So I'll pause there and let you
Yeah.
keep going, Claire.
Yeah, we'll operate because, as you said, I mean, the federal government could come up with a plan, but then essentially it's up to the 10 provinces to output it, right? I mean, it varies per province. So, I mean, as time goes so quickly, um, what could we be doing better? How do we fix this problem? And it's a broad question for you, but like, what, in your opinion, how do we fix? What can we do better? Like,
Um, I mean, I can speak to what the Alzheimer Society of Canada has been doing in where we think our role can be. Um, we do work with the federal government. Of course, we'd been advocating for the strategy for over 10 years, well before my time. That advocacy had been going on. And so having the strategy and having it sort of enacted into law was important because it's not just something that you can put on the bookshelf and say, well, it's done and dusted and now it's over.
mhm.
Um, but an area that I think needs to continue to happen is advocacy. There needs to continue to be a lot of advocacy for those better dementia care pathways. And I think there also needs to be better work around educating family doctors because
Mhm.
they're the hubs. They're the entry point into the health system. They're the ones who manage the patient over time. We don't have enough specialists. Are the specialists needed yet? Yes, but we don't have enough of them to diagnose and manage this disease. And so I think educating family doctors is a crucial area. We're working with McGill as well as with the Canadian Family Physicians Associations to create national dementia guidelines to really support family doctors, meet them where they are, and we did a survey actually 2 years ago, a national survey where we asked family doctors, what are your pain points? Where are you struggling? Um, Often the problem was less about the diagnosis. Many felt they could make a diagnosis. Where they struggled was, how do I deliver this diagnosis? I don't
Mhm.
know how to tell my patient in a person-centered way that they have dementia. And I think that's also because they don't know what to do next. Okay,
Mhm.
now I tell you you have a diagnosis, but I don't have the tools to support you. And so I'd rather not tell you. Or if I tell you, the next question that will come from families will be, well, what do I do next? And I don't necessarily know what that is. So that's an area that we've been focusing on at the Alzheimer Society and really supporting family doctors um, to better support caregivers as well as people living with dementia post-diagnosis. But there's a lot that needs to be done at the policy level as well within the health systems, and we'll chat about that.
One of the priorities that we have actually at McGill and working with Dr. Gauthier and Dr. Moret is we're really looking at how could we enhance the medical curriculum for those students, right? Because
Yes.
education has to begin in the classroom when there's
Mhm.
when before those family doctors actually get into practice, right? And I
Yep.
think one of the challenges, not only in Canada but everywhere, is I feel like the medical students, they learn about a disease and the pharmacological approaches that may or may not work, but it's that whole non-pharmacological approach or having those
Yes.
caring conversations or, based on the surveys and the reports, also family doctors are limited by time, right? They're
Yes.
expected to see so many patients in an hour. Dementia presents with so many varying symptoms.
Hmm.
Family
Hmm.
doctors are expected to be able to diagnose so many illnesses, but dementia in itself is such a specialty. So I think yes, a lot of emphasis has to be done, has to really really be done in better educating them, better preparing them, and then also the continuing education, right? Like there's so many family doctors out there who probably had never even learned about dementia in their practice years ago. So yes,
Hmm.
go on,
Oh,
you can
sorry.
add to
Well, I
that.
didn't want to interrupt you,
Yeah,
Claire, but
yeah,
yeah, I think and acknowledging that they don't have good supports either.
yeah.
Family doctors themselves, even if they have the education, don't necessarily have the supports they need. I mean, there's remuneration, exactly as you've already talked about. They are paid, fee for service still for the most part. And dementia is not a 10-minute discussion. Not
No.
even by a long shot. And dementia itself, even if you were able to address the dementia, it's going to impact everything. Most people don't ever just have dementia. They have diabetes, they have, COPD, they may have other health conditions that are all going to be impacted by that diagnosis. And so you've got to address things much more holistically. And I think you're absolutely right. The pharmacological side of things is where we tend to focus. Our entire health system is focused that way.
Mhm.
But for dementia to be managed effectively, it cannot just be the pharmacological. Most of it is actually
Mhm.
non-pharmacological, but takes time because it's individualized. You actually have to sit down and understand why your patient might be sleepless. Why are they waking up in the middle of the night multiple times? And what are the environmental factors that might be impacting that, for example? And family doctors aren't supported in being able to do that well.
So my last question is, can you give us a bit of an update on research? Like, where do we stand with research?
So the Alzheimer Society funds about $3 to $3.5 million in dementia research exclusively every year. And one of the areas that we've really emphasized over the past 3 to 4 years in particular has been innovative research. Now, I know that term gets used a lot, so I really want to clarify. We're very specific about what that means. Um, a lot of the main hypotheses and theories around dementia have existed for a good 20 years, and we've spent a lot of money on it. And I think we need to continue to explore them. But we recognize more and more that dementia is a collection of diseases, which means it's going to be a range of different theories that need to be explored. There's not going to be a silver bullet. We see that with aducanumab, with lecanemab. None of them are going to be this one cure approach to dementia. It's going to be a cocktail of treatments as well as non-pharmacological treatments. And in order to get to that, we need to think more broadly. We need to think outside of the box. We need to be willing to explore areas that we might not have earlier. So some of the areas of research include things like the immune system and inflammation and how that might be impacting dementia. Things like gut bacteria and mouth bacteria and how that might be impacting dementia. And so those are areas that we've been funding at the Alzheimer Society. But the flip side to that coin, as you've talked about, is the non-pharmacological. What are the options, the therapies that can help in the here and now? So we fund what we call quality of life care, treatment, and these could be things like well, recently you might have seen in the news, Dr. Don Weaver will sometimes say he prescribes poetry to
Hmm.
people living with dementia. Things like music therapy, aromatherapy, things like how do you support someone who has behavioral changes with the disease. These require good grounded research as well. And then the third area in terms of the state of research for dementia is risk reduction. Again, I
Mhm.
can't emphasize enough. We've heard it a lot, and those factors cut across for what's good for your heart is good for your head. So physical therapy,
Mhm.
physical exercise, etc. But there are things specific to dementia that don't cut across. Things like social isolation and how it plays a key factor in as a risk factor for dementia, hearing loss, sleeplessness, cognitive reserve. These are things that are specific to dementia that we understand a lot more in the research space. And so it's the area I'm most excited about, I would say.
Well, thank you so much for taking the time to be with us. I mean, I could continue talking to you for another 2 hours, but I know that the Alzheimer Society of Canada is such an important organization in our country, and you have a wealth of resources. Under our trusted resources section, you're one of the top, links that we have. And again, that 1-800 number, we'll make sure that we have the link so that people could go and obviously also by Googling on your website and going to our website, but we'll make sure that people are aware of that number. So thank you so much for taking the time to be with us today.
Oh, it was my pleasure. It was lovely chatting with you, Claire, and I look forward to more conversations in the future.
This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program, please visit us at mcgill.ca/dementia. And if you would like to join our mailing list to be notified about upcoming episodes of McGill Cares, as well as other important programs and resources from us, you can email us at dementia@mcgill.ca. Thank you for watching.